Hi students, today we will be discussing on principles of tooth preparation. Principles of tooth preparation is also a very important essay question, can be also asked as a short note. Above all, it is a very important topic from the clinical aspect. Whenever you're doing a crown preparation or for a FPD preparation, it's very important that you know the principles of tooth preparation. Basically, what is tooth preparation? The selected form given to a natural teeth when it is reduced by instrumentation to receive a prosthesis. The definition is very clear from the definition itself, meaning the selected form which is given to a natural teeth. So, a natural teeth is given a form. The form is selected by the operator. Now, how is the form given? It is given by reducing the tooth with instruments. That is, in this case, we are using a aerator and the diamond burrs. Now, why is this done? Why is this selective shaping of form given? We do it to receive a prosthesis. It could be either for a crown or a retainer of a fixed or a removable prosthesis. Now, selection of the form is guided by clinical circumstances and physical properties of the materials to make the prosthesis. So, 2 points which needs to be considered when you are doing the tooth preparation. That is, what will define or determine the type of shape or the structure that you're going to give the tooth is determined by the clinical circumstances. That is the amount of tooth structure which is present there, amount of space which is available, the height of the crown, various other factors, how many teeth need to be prepared, how many teeth are missing, all this will determine in the clinical circumstances. What is the second property? That is the physical property of the material. That depends on if you're giving a metal prosthesis, a ceramic prosthesis, a zirconia or an all metal, all ceramic prosthesis. Now, all this will vary the amount of tooth that you're going to prepare. Principles of tooth preparation. What are the principles? Ideally, this was given by two people. One is by Schillingberg, the other is by Rosenstiel. So, when it was given by Schillingberg, Schillingberg classified it into 5 headings. Okay, he sorted it into 5 headings which said preservation of tooth structure, retention and resistance form, structural durability of the restoration, marginal integrity and preservation of the periodontium. So, these are the 5 principles of tooth structure which was given by Schillingberg. Whereas, there was some more which was given by Rosenstiel. Okay. When it was given by Rosenstiel, he classified the same headings which were given as 3 different ones. Okay. He mentioned as biological, mechanical and aesthetic. Okay. Now, all these 5, the same 5 headings were separated as biological methods, biological principles, mechanical principles and aesthetic based. Okay. So, that was given by Rosenstiel. Now, Schillingberg principles, it determines the shape and form of the preparation. Now, it cannot be considered in isolation and differs to each individual clinical situation and a balance is created. Before we discuss in detail about the 5 principles that we are concerned about, there was something which was called as Goodacre's principles which was stated. Now, Goodacre, he did not shortlist or shorten it into 5 headings, but what he did was he gave a general set of principles which need to be followed for all the teeth when you're doing a tooth preparation. So, the Goodacre's principles were the total occlusal convergence should be around 10 to 20 degree. We will discuss in detail about each of these which is considered now and which was stated. Okay, these were the principles which were stated by Goodacre, not that it is followed today. Minimum height of the incisors and premolars should be around 3 millimeters and that of the molars should be around 4 millimeters. Now, the ratio of the occlusal level to the finish line should be greater than 0.4. Occlusal and circumferential irregularity should be maintained for better retention of the prosthesis. In absence of retention, you can create boxes or grooves. Finish line placement. Supragingival margins were permitted. Subgingival margins should not extend to the epithelial attachments. Now the finish line forms. Chamfer finish line for metal crowns, but both chamfer and shoulder, which was allowed for bonded porcelain prosthesis. Adequate reduction would be for metal around 0.5 mm axially, 1 mm occlusally. For metal ceramic is around 1 mm axially and 2 mm occlusally. Line angles are present but should be rounded, and surface texture should be roughened. These were the Goodacre's principles which were stated. Now let's come to discuss each of the headings under Schillingberg's principles of tooth preparation. So in that, the first one was preservation of tooth structure. Whenever we mention about preservation in prosthesis or in dentistry in general, the first statement that we do is the Devan's dictum. Now what does Devan state? Devan stated, the preservation of what is remaining is more important than the meticulous replacement of what is missing. So, the preservation of what remains is important than meticulous replacement of what is missing. In prosthesis or prosthetics, when we talk about, we are not looking to just replace what is lost. We replace what is lost along with a harmony or preserving what is remaining in the oral cavity. So just because you want to replace one tooth does not mean you need to remove the adjacent two teeth and then go for replacement. No, you are looking for preserving what is remaining, and then in harmony with that, you are replacing what is missing. So in tooth preparation, when we talk, when you are reducing a tooth or preparing a tooth, the first thing is, do not remove excessive tooth structure. So if this is your teeth, you have a certain amount of tooth to be reduced. You need to reduce it maybe till around, this is how much you have to maintain and then reduce. You cannot at one stretch reduce a whole tooth into this small a tooth. Okay, you cannot make it to this small because you are going to lose out on all the other upcoming factors. Okay, so first thing what will happen is, if you make it so short, is that the tooth becomes very weak, right? Because there's a lot of tooth structure which is lost. Second thing, where is the pulp? In this tooth, the pulp is approximately going to be around here. If you reduce it to this level, you're going to jeopardize the pulpal health. Now, reduction should be inadequate. You have to reduce, but it should be adequate, because less reduction will again lead to an over-contoured restoration. If I do not give at least this much of space when I am reducing, where will I place the prosthesis on top of that? There will not be any space. So it will be an over-contoured restoration. It is chosen for the crown. Is it a metal? Is it a porcelain fused to metal? Is it an all ceramic? Okay. Now, second thing is aesthetic concern. If you are doing an anterior preparation, you need to give more aesthetics in the anterior region. So you are going to do more reduction on the buccal and lesser on the lingual surface. This is done for altering the aesthetic purpose. For metal ceramic restorations, you do a labial reduction of about 1.2 to 1.5 millimeter. Lingual reduction is around 0.5 to 1 millimeters, depending on if it is a metal or a veneered with porcelain. Now, incisal or the occlusal aspect is definitely going to be around 2 millimeters, nothing less than 2 millimeters. So, for a full metal, you have 1.5 mm in the functional cusp and 1 mm of the non-functional cusp. For metal ceramic or the porcelain fused to metal, PFM, which is called, it is 2 mm functional and 1.5 mm of the non-functional cusp. Now, what is or which are the functional and non-functional cusp? So, to easily remember the functional and non-functional cusp, there is something called as the Bull's rule. The Bull's rule does not indicate the functional cusp, rather it indicates the non-functional cusps. Okay. So, it is upper buccal and lower lingual. So, you have upper buccal and lower lingual, which is the non-functional cusps. That is why it is called as the Bull's rule. Okay. So, to easily remember which are the functional and the non-functional cusps, just keep in mind the Bull's rule. So, which means your Bull's rule, upper buccal and the lower lingual are your non-functional cusps. So, automatically your upper palatal and the lower buccal will be your functional cusps. Like when I said preservation of tooth structure, you always look for a two-plane reduction. You are not going to reduce it in a single plane. You are going to always have a two-plane reduction so that you give a proper convergence and you give proper aesthetics. When you see this tooth which is prepared, it is a two-plane reduction. It is, you have one plane here and the other plane which goes inside. Okay. The same way in this tooth, it is one plane here and the other plane which goes inside. Over reduction, especially when you're replacing an old restoration, you need to cut the prosthesis and see if there is adequate tooth structure. If you see this tooth, it is an over prepared tooth. There is hardly any tooth structure to hold a prosthesis. Now the prosthesis will retain because of the undercut which is present here. Can you see? This tooth is standing out and this is also standing out. So the prosthesis is going to lock in between these two teeth. It will stay. But there is be absolutely no retention from the tooth structure. Next is, just by looking at the buccal aspect, you cannot determine if it is ideal to just go for a crown or if you need to do a proper post-endo restoration or a post and core. This tooth structure here, it looks big enough. Once you see from the buccal aspect, there is tooth structure, right? How about it from the lingual surface, from the intaglio surface? This is the structure that we saw. But look at the palatal wall. There is absolutely no mesial wall at all. The mesial wall is completely lost. You only have a buccal and a slight distal wall. The palatal wall is also very small. So, in such a case, you cannot directly go for a crown. First, you need to do a post-endo restoration with post and core and then go for a prosthesis. That was about preservation of tooth structure. Next is coming to resistance and retention form. What is retention? That is, prevents the removal of restoration along the path of insertion of the long axis of the tooth. If this is your tooth structure and I am placing a crown, retention means when I try to take it out like this, there is resistance, okay, along the path of insertion. So, this is the tooth, this is the long axis of the tooth, and this is your placing it in the path of insertion along the long axis of the tooth. So, resisting towards this motion is called as your retention. Now, what happens when you have an over tapered restoration? As the taper increases, you have multiple paths of insertion, right? You can put it straight, you can put it through the sides. There is no proper retention form. So, therefore, multiple paths of insertion will reduce your retention. Next, what is resistance? Resistance is basically which prevents dislodgement of the restoration by forces directed apically or obliquely and under occlusal forces. So, like I said, the retention was along the path of insertion when you are trying to remove a crown. That force is the retention. What is the resistance? When a crown is placed and you give oblique forces, that is lateral forces, it should not displace out. So, in this, when you see, the taller the tooth, Okay, lesser the chance of displacement during oblique forces. Whereas the shorter the tooth, when you give an oblique force, it will just pop out. Now, how do you enhance your retention forms? Moving it along the dislodging forces or resisting the dislodging forces, geometry of tooth preparation, roughness of the fitting surface, the cementation materials which is used, and the luting agents. What are the dislodging forces that can act? Sticky food, then forces while brushing or flossing under the connectors. Brushing or flossing under the connectors. Geometry of tooth preparation. First foremost is the taper of the tooth. If this is the tooth and this is the preparation that I am going to do, so this is going to be the taper that we are talking about. Okay, that is the taper. Substitution of internal features, the path of insertion, freedom of displacement, length and surface area, stress concentration and type of preparation. What is the ideal taper? Ideal taper would be, what is the ideal taper? It would be around 6 degrees. Convergence should be maximum of 3 degrees. The best retention is given when the walls are parallel to each other. Now, what is the difference between this taper and convergence? When I talk about both the walls together, it is 6 degree taper. When I talk about only one wall, it is a 3 degree convergence. So, 3 degree together gives 6 degree of taper. So, you are looking for 6 degree taper, which means on either side, you are going to be reducing 3 degree convergence. So, here it should be 3 degree and here it should be again 3 degree. Totally it comes to 6 degrees. Now, coming to substitution of internal features. Like I mentioned, most ideal retention form is parallel walls. Okay, but mostly in clinical situations, since that is not practically possible, you can either add grooves, boxes, or pinholes, just to make sure none of these should involve or touch the finish lines. Freedom of displacement. You put retentive features or retentive grooves which gives you resistance towards the freedom of displacement. Otherwise, once you place the crown, there will be multiple ways the crown can come out. Okay, resisting that feature is called as freedom of displacement. Now, coming to the length and the surface area. In such a small tooth structure, look at the structure. In this, there is no adequate length and no proper surface area, because of which so in this length, this is your fulcrum and it takes this much force to dislodge the crown. As the crown height decreases, the fulcrum line is shifted and the crown is dislodged easily. Coming to stress concentration, what happens when you do not roundin your internal line angles or the edges of the preparation? These points or the sharp points becomes the area of stress concentration. So, once you place the prosthesis, these sharp areas of the line angles or the edges become what you call as the stress areas. So, whenever there is force which is given, lines of cracks are propagated from these areas. Now, coming to roughening of the surface will enhance the mechanical retention of the crown. You can either do it by grooves on the tooth surface or by sandblasting the internal surface of the restoration. Now, variations in the luting agent. Different types of luting agents can be used. Now, in that, the best retention is by adhesive cement. Then comes GIC or glass ionomer cement. Then it is zinc phosphate or zinc polycarboxylate, and the least retention is provided by zinc oxide eugenol. Now, this is the reason why GIC and adhesive cements are basically classified under permanent cements. Zinc phosphate or zinc polycarboxylate are semi-permanent cements, And zinc oxide eugenol is usually a temporary luting cement. Mostly semi-permanent cements like zinc phosphate or zinc polycarboxylate is used for like you want to place a temporary restoration for a longer period of time. Okay, maybe for you want to keep it for about 3 to 4 months or 6 months. You use a semi-permanent cement. The reason why you do not use a permanent cement in such a case is that once you lute it with a permanent cement, it is very difficult to retrieve or remove the processes. As the time moves ahead, the retention of these cement becomes much more stronger. Whenever you do a tooth preparation, the maxillary molars usually gives a rhomboidal shape. Can you see here? This is a rhomboidal shape. The mandibular molars are usually rectangular in shape. The premolars and the anteriors will usually have a oval shape. Okay. Now coming to the placement of grooves. Grooves are never placed on the corners of the teeth, and mostly it is either on the proximal aspect or in the stress bearing area. Coming to structural durability. Now structural durability, there are 3 aspects which is covered. One is the occlusal reduction. In the tooth, this is a tooth which is of concern. This reduction is going to be called as the occlusal reduction. Functional cusp bevel. Just imagine this is a mandibular molar. Okay. So this is your lingual and this is your buccal. So like we mentioned, Bull's rule. So lower lingual is your non-functional. So your functional cusp will be your buccal. So this is your functional cusp. Now here we usually give something called as a bevel when you're doing the preparation. Okay. On the functional cusp, you're giving a beveling is done. Okay. That's a functional cusp bevel. And then the axial reduction. So this is your occlusal reduction, the functional cusp bevel, and this area from the sides that you're removing, this is called as your axial reduction. Okay. Coming to the occlusal reduction. In full metal restorations, the functional cusp is reduced to 1.5 mm, non-functional cusp to 1 mm. Metal ceramic restorations, functional cusp is 1.5 to 2 mm and non-functional cusp is 1 to 1.5 mm. All ceramic crowns, when we talk about all ceramic crowns, I mentioned it is about lithium disilicate or Emax crowns. It is almost around 2 mm all over. Now coming to functional cusp bevel, like I mentioned, this is your functional cusp. Okay, so this here we place. If it is placed sharp like this, what happens? There is a thin area where the casting is done. So there is chances of perforation. Second is, in that area there will be too much of bulk of the material. So it gives over contouring. And again, when you're trying to overpass it, you're going to over incline or over taper that area to correct the over contouring. It leads to over inclination. Okay. So to avoid that, what we do is we bevel this cusp so that whenever the ceramic is added, there is more of material on this area. Otherwise, if it is too sharp and thin, on the functional area, there is a stress concentration point which is created and it can cause a crack and lead to the fracture of the tooth. Next is the axial reduction. Axial reduction I mentioned when you're reducing from all around the tooth, the buccal, the lingual and the mesial and the distal areas. Thin walls of casting which can subject to distortion, over contouring or disastrous effect on the periodontium. Okay. Next is coming to the marginal integrity. Marginal integrity is where you place the margins and what type of margins you're placing. So types of margins and the position of the margin. In this, coming to the type of margins, you have chamfer, you have shoulder margins, you have feather edge margins, you have knife edge margins, okay, and you have beveled shoulder margins. Coming to the position of the finish line, you have 3 positions. You have supragingival, that is supragingival, that is above the gingival level. equigingival, which is at the level of the gingiva, or you have the subgingival, which means you are going underneath the gingival level. Coming to preservation of the periodontium. Now, this depends on various factors. One is the margin placement, the margin adaptation. Then you have to avoid soft tissue injury and proper cord placement. When you talk about preservation of margin, it is very important that you mention about the biological width. What is the biological width? It is the distance from your bone level. This is this area till the junctional epithelium. This is basically called as your biological width. In normal situations, it is about 2.04 mm, of which 0.97 is the junctional epithelium and 1.07 will be the connective tissue. Together, it forms as the biological width. So, you have the gingival sulcus. This is basically your gingival sulcus. This is the tooth structure and this is the gingival sulcus. So, at the base of the gingival sulcus starts the junctional epithelium. Okay. Now, from there till here is the junctional epithelium. So, this distance plus the distance from this junctional epithelium till your bone level, that's a connective tissue area. So, this total area is called as your biological width. Now, one major factor about biological width is that as your crown encroaches down this junctional epithelium, that is, if it goes beyond the junctional epithelium, the bone which is present here will start resorbing down. This will slightly resorb down to maintain the biological width. The biological width will not change in any normal situation. If you try to encroach into the biological width, what happens is the bone will resorb slightly to maintain the same biological width. Now, that was about the Schillingbugs. Now, I also mentioned there is a classification which was given by Rosenstiel. So, this is how it will be seen as Rosenstiel's. This is the biological. Okay. So, in the biological, we have conservation of tooth structure, avoiding over-contouring, placing supragingival margins, harmonious occlusion, protection against the tooth, opposing tooth and against the fracture. This was the biological. Next will be the mechanical. In that, it is discussed about the retention form and the resistance form. Next is the aesthetic. So, this is the third circle, biological, mechanical and the aesthetic one. Okay. In aesthetic, you should have minimum metal display, maximum thickness of porcelain occlusal surface and subgingival margins are advocated. A harmony between all these three will give you an ideal tooth preparation for a perfect prosthesis. Now, this was determined, this concept of principles of tooth preparation was given by Rosenstiel, whereas the other 5 which we discussed earlier was given by Schillingburg. So, whenever you write any short note or an essay about principles of tooth preparation, you do not, first you classify and then you can explain in detail about the Schillingburg classification because the components which comes under both is the same. Thank you.